So there's a common question that I always get, and it is, why did you choose nursing? Well, there's a few different reasons, and it takes a little bit of time to explain. But now that I'm on YouTube, I have a chance to share with you 6 reasons why I choose nursing and why nursing might be a good career choice for you. So, number 1 is I had a role model. And to get anywhere in life, it's really nice that if you have a role model. And I was influenced by my mother, who was a nurse at the time. She was on a cardiac unit, also known as called telemetry, and she worked for about 10 years as a nurse. When I was growing up, I would go visit her, and people would tell me about how awesome of a nurse she was and how great she was to work with, and that was cool to see and be able to have that accessibility to see the hospital in that regard. She gained a lot of respect. I remember telling my teachers at the time, saying, hey, my mom became a nurse, and I'm just young, and I didn't think too much of it. And they would say, wow, no, really, that's so awesome. So it made me understand of how important and how awesome it is to even be a nurse. And this I want to talk about as well, because I think it's important. And, nursing as a profession, I would say, saved my household growing up. So there was the 2008 recession, and I come from a family of carpenters for generations. All my uncles do it. My dad does it. And my dad was the breadwinner at the time, and 2008 hit us hard. So, we were struggling, and it was rough. We were having a hard time making ends meet. And, by the grace of God, she ended up becoming a nurse at the same time. So now that we had a trouble with income coming in, she became a nurse and was able to pick up so many hours that helped put food on the table and get the bills paid while things ramped up, and for my dad to start picking up jobs again. So that was a huge, huge, huge plus, and that was something that stood out to me, because while everybody else was struggling with work, she had a secure job. So that was huge. So I saw that at a young age. Number 2, when I was in high school, I was very interested in health and fitness. I was working out a lot. I was playing basketball. I played football. I was playing baseball. And yeah, like in my off seasons, I was making sure I was lifting and training. And to maximize my training, I would always look up, how to build muscle, why your muscle grows, what foods help your muscle grow, what do proteins do, how does your muscle contract, how does your body digest certain things, and what shouldn't you eat with certain foods, all kinds of stuff like that. And I caught myself spending hours watching people's YouTube videos on that. And when it comes to nursing, you're going to learn about different systems. You're going to learn about, your pulmonary, your cardiovascular, musculoskeletal. There's just so much to learn. And I wanted to get a deeper knowledge on the entire human body and how things function properly. I wanted to just learn that in advanced level. And also, credibility is important too, because you can't really just take advice from somebody who doesn't have any background education. So, if I was going to give advice in the future, it would be ideal for me to have, RN next to my name. And I would say, okay, well, yeah, he took the courses, he works in the field, he knows what he's talking about. So it was I was interested in having the credibility in the title to be able to teach people about health. So, also, number 3, service to community. Nurses play a critical role in society. A lot of people refer to them as heroes. And, not even necessarily just nurses, but, firefighters and EMTs, doctors. There's a lot of people in the community, the police officers that really are tight with the community and take care of their people. And I wanted to, in a sense, give back and be able to serve my community. So there's a sense of fulfillment that goes along with that. And what's important is that it gives you a sense of responsibility, because when you realize that your life is not necessarily just for you and it's for the benefit of other people, your life grows tremendously. So you'll be seeing traumas, you'll be seeing the motor vehicle accidents, seeing people that got stabbed, some people that got shot. And as unfortunate it is to see these bad things, at least you know that you're in direct care with those people and you can help them through a tough time and be able to speak life into them and things like that. So I wanted to play that role in a lot of people's lives. So I would see my teachers, my friends family, not that I could take care, of my family, but I would still be, they would be on my unit and I could check in on them. And, it's just so cool. You would have to go through it to experience it, but it makes you feel very important and helpful for these people. So number 4 is guarantee. This is a very huge one. I almost wanted to make it number 1, but nobody comes before mama. So, so number 4, guarantee. Job. You're going to have job availability. You're going to have flexibility and stability. So for availability, I could move to Texas next week and I could have a job almost instantaneously because there's a shortage of nurses. And as long as you got that paper that says you're a nurse, you're going to get hired basically no matter what. It might not be at that hospital you want, but you will get hired sooner or later. There's a lot of people that go to college and they graduate and they don't use their degree. Then they have a loan and they don't know how to pay the loan, and it's a whole ugly road to go down. But it's a reality for a lot of people. So, don't be too general when you go to school. If you don't know what you want to do and you do want to work in healthcare and you want to have a secure job, that's huge. Availability. You don't want to go to something that, there's not a demand for. Flexibility. So your job is going to be flexible. You could work nights if that works best for you. I have a video on the different shifts as well. You could work mornings if you like the mornings. You can work the evenings if you like the evenings. And you also don't have to work 5 days a week or 6 days a week. You can work, 3 12s. You could even work doubles. You can work 16 hours at a time, and you can get your 40-hour work week. Some people work 24, some people work 36, 32, all kinds of different hours, mandatory. So if you have another job, totally unrelated to nursing, or if you have another nursing job, you can still mix this in and be fine. Even if you need to call out, you get plenty of paid time off. There's a lot of benefits that comes with using your schedule around the nursing career. Stability. Unless you totally, inject air into a patient's IV line or something, you are basically almost always going to have a job. As long as that hospital doesn't get burned down and you have to find a new place. There's always going to be a job for you, and it's a very secure job. So let's move on to opportunity, which is number 5. This is another huge part that made me realize that nursing would be a good step for me. And it's not a dead-end job. You don't show up and it's struggle for you to get raises and you don't have any growth room. You could only go so high. There's a lot of things that you can do in, healthcare in general and just being a nurse. So you could advance your career. You could be a nurse practitioner. You could go back to school, get a few more credits, and then work directly under a doctor and help them see patients and stuff like that. Be able to prescribe medications. You can go to CRNA school, which is a certified registered nurse anesthetist. So you'll be able to, you'll be working under an anesthesiologist, being able to put people to sleep during the surgery, monitoring them, keeping them alive, and administering the anesthesia to keep them sedated and all that kind of stuff too. You can even go back to school and get your master's. You can get your MSN. So you can, if you want to teach and you want to go back to school and teach, nursing students or, train people in clinicals. I know sometimes you could be a bachelor's now and, some people are okay with that, but you can go get your master's and, do teaching if that's what your heart calls for. Opportunity, travel. So I've had a sister and, I have two sisters that travel now. There's three nurses out of the siblings that are nurses. So they travel now. So she's been to Florida. She's been to Arizona. She's been to a lot of places. I visited her. We've seen the Grand Canyon, doing the helicopter rides. She stayed in Florida, these nice places. And it's just cool to be able to get out of your hometown and get out of your normal way of living. If you're so, accustomed to living at home and maybe you're struggling at home and you don't want to live with your parents anymore right after college, if that's your scenario, and you want to just bounce and go try another area of the country. And maybe you want to relocate, so you could go live in Georgia, you could go live in Montana and find a hospital that needs travelers, and you make great money when you do that too. We'll get into that on the finance side. for opportunity, if you don't like bedside nursing, you could do home care, you could do specialized care, you could do, even research, nursing research. There's so many jobs regarding, that you can get with your nursing degree, and there's going to be something that fits your niche. There's people that are doing Botox injections now and all kinds of things like that. So maybe in 10 years or so, I'll have to go see some of these people. So finances. I left this last because I think it's important. I think it's a little bit of an attention grabber too, because a lot of people are so hung up and say, oh, nurses get paid so well. Some people do jump into nursing just for the money, which I wouldn't necessarily recommend, because you got to be a people person, and you got to want to do these steps if you really want to focus on getting the money out of nursing, because you'll get burnt out by them if that's not what your heart tells you to do. So for finances, your income expected after graduation. A lot of people don't want to talk about money. I have no problem talking about money just because money is relative. So I believe I think I started at $33 an hour. I think I was 21 years old. So it was like $32 an hour. Not in a bragging right. At that point, that's basically more than a lot of people that are going to be graduating at that age, and you get a job very quickly. So you could come out of college making $32 an hour. And if you watch one of my other videos, we go into the differentials and what differentials are and how you can get paid off of that. So if you work evenings, you can get an extra $3. If you work at night, they'll give you an extra $10. So you can get paid $42 an hour. I mean, $42, $43 an hour right after college, which is nice. If you decide to pursue this career. So it's a good head start. You can start paying your loans off, and you can start, buying things that you want to buy, and, budgeting and investing in other areas. And that's huge. That's under the finances too, is because just because you get paid this money, you don't want to just go and spend and be a big baller. Make sure that you're investing a lot of the money you're making at an early age, whether it's paying off your debt or, trying to buy property and flip property and stuff like that. Because if you get through nursing school, you're already a hustler, so apply your work ethic in other places too. Also, the differentials and the bonuses. During COVID, we were getting huge, fat, juicy bonuses to go and work. I was making 3 digits plus an hour on a lot of these bonuses. COVID was a mess, but it was nice to be able to get compensated, with your time like that. The bonuses have stopped now, but when they really need nurses, they'll give you a bonus, and that's nice because extra cash is always good. Also, you get your benefits, retirement, and your insurance. When you work for a lot of these hospitals, some are better than others, whether on the benefits that they give you. But you can get insurance. Sometimes it's some places are more expensive than others, but there's a lot of jobs that you get out of college and they don't give you these benefits. So they'll match some of your retirement. They'll give you a percentage of what money you put in, and then you get your eye insurance and all that kind of stuff too. The travel bag. The travelers are making some serious cake. Those are probably the breadwinners, with a regular, BSN. So again, especially during COVID, there was nurses making insane money. I mean, you're probably talking 3, 4, 5, 6, 7,000 plus a week, which is incredible. I don't think that'll ever happen again. But when you have something that is limited, like a registered nursing license, people will pay you the money when they need you and when times get rough. So it's always nice to have in your back pocket because you could use that to your advantage and be able to help people and get paid for it at the same time. And the main part that means the most to me is it's perfect for side hustles. And it's something that's not talked about enough because people just think, you're a nurse and that's it and you're done and that's all you can do. My recommendation for anybody who doesn't know what they want to do and then you still have a lot of these interests is I would go into nursing, and you can work 3 days a week, 4 days a week, and you have basically the rest of the week off. You can work on side hustles. You can still do construction. You can still be an electrician. You can still be a plumber. Well, plumbers will be busy, but there's just so many jobs that you can do. Like I work with someone who owns a restaurant, and it's a Mexican restaurant, and she stays very busy. They have a food truck, and her husband runs it. And then when she's working off, when she's not working, she's working on the truck, and that's like the family business. So now you're working with something that can scale, and you have a 100% income coming from somewhere. So even if nobody goes to the truck for a week, that household still has income, and it's gonna help your family a lot be able to grow and be a healthy, strong family. So for me, and it's awesome because I can work in the morning, go to the hospital after and work, and then I can do that, and I can fit in a lot of time. That's gonna put money in my bank account every week. And you know, I do well for myself at this age, but again, money's all relative. A little bit of money is a lot of money to somebody, and a lot of money is little money to somebody else. So there's plenty of room to grow. There's plenty of ways to capitalize on this career. And yeah, I hope that going through this gives you a little bit more of a clear description on whether or not nursing would be for you. If you have any more questions, please ask in the comments and I can address them. And if there's something else that you want to see, that you have a question that I should make a video on, just write it in the comments, and I'll make sure I can make a video on that, because I want to teach people what I've learned, so that way I can save your time from the time that I've spent in nursing. So thank you guys, and I'll see you on the next one.